So how are you doing, buddy? How is it?
So the camera's not going to know this, the audience watching this aren't going to know this, but this is my third session now with Radu. So I did see him last week just to go over some extra rehab exercises and also have some treatments as well, which you'll probably see today. So I'm sure we'll probably go over that as well. So this last week, it's been weird because I know when we had the treatment last week Friday, you said to rest it over the weekend, which I did do.
Yeah.
So my first session was on Monday, and then we're doing it every other day, so I've done Wednesday, and then today is effectively a session with you.
Yes, correct. No, very, very good. Well done. Yeah,
so
that's well organized.
In my mind, I'm thinking that I should be doing more. It almost feels like I'm not doing enough, but on my Wednesday session, when I'd gone through the exercises with the Swiss ball and the exercises what you given me last time, even when I was doing it, I could feel like my shoulder was aching. And even afterwards, when I left the gym, it felt like it was quite sore. There was no sort of grinding or anything when I was going through the exercises, but it felt sore. So I understand the reason why you want me to do it every other day. I guess the thing what I found the hardest was when I was doing the Swiss ball exercises, because I know when we was going up, you said you wanted me to feel like it's engaging the serratus.
Yeah.
I don't really feel that at all.
Yeah, we're gonna adapt it. We're gonna feel something. So we're gonna do. We started with that today. Today I have something else in my work. We're gonna try to literally just inch it on the wall with a band here, and we're gonna try to just literally just walk up the wall again by doing the same thing, like getting your scapulas out, keeping your elbows in, and just literally we're just gonna try to inch up on the wall to start to strengthen that serratus.
Yeah.
So we're gonna see if we get any joy with that, because again, it's experimental. Everything with you, it's to a certain degree experimental, because again, it's a unique case, like I said last time. The fact that you are the size you are, the fact that you have that glenohumeral joint, which is knackered.
Yeah.
Luckily, we got soft tissue that's not that affected. Well, we got the capsule that's affected, that is being cleared out of. Capsulitis has been released, so that's the only soft tissue that's actually been worked on. The rest of them, supraspinatus, infraspinatus, subscapularis, all the rotator cuff muscles, from what we've seen on the MRIs, seem to be intact. So we got something to play about with, and that's what I said in the first time when you got the cameraman and here. I said that's what we're clinging on to. We're clinging on to create that much stability coming from your rotator cuff that's going to offer you that exactly what you need, the strength that you need to kind of get into the positions that you need. Because that's our only salvation to do. So that's what we need to work on, and that's what I said to you. We have to be patient, because you have to realize not many people are prescribed exercises straight away after shoulder surgery.
Yeah. And
you have to realize it is a massive trauma to the shoulder, although yes, it wasn't open surgery, it was keyhole surgery, but still it's a massive trauma, and we can't just push it, because all we're going to do is just going to reinflame, and we know that that's leading to, again, I'm pretty much repeating myself, but that is what's causing that capsulitis, repeated inflammation in the joint, and we try to avoid that. The fact that you say when you do the exercise you feel sore after, I mean, you can make a difference between muscular soreness of certain muscles that are obviously impaired and they're atrophied and they're not working to the optimal work that they should do. And you obviously as a bodybuilder should be able to make that difference of like, is this muscle soreness of these little muscles that I have underneath my deltoid, or is this actually like kind of a soreness of inflammatory soreness? So what would you say that is, that soreness that you had after the workout?
It felt like it was the muscle what was sore.
Well, that's great.
In my opinion, it felt like that, because when I was doing the exercises, there was no grinding or anything like that.
Well, that's exactly what we're looking for. So we're looking to get that muscle soreness, because that's what we want. And you, out of everyone, really should know what muscle soreness, what DOMS means, and what a soreness caused by inflammation because of the grinding bone to bone. That's why we said so far we're going to try to stay away from anything that feels grinding, because that's what's going to cause further osteophytic changes, further inflammatory changes in the joint, which will lead again back to adhesive capsulitis. And I'm not being funny, but then we have one massive reason, 3.8 centimeter osteophyte, inferior osteophyte, and then we get the whole of the ligament around the whole capsule around the glenohumeral joint that's going to stiffen up, and it's not going to allow us to do any movement. So we try to avoid. We know we got the osteophyte there, but now we have that capsule release, but that capsule only needs that to start going rogue again. And that's what we need to keep it up to that point.
Well, I just watched I just watched last week part of the video from last week, and I gotta say to your audience, I apologize for the excessive swearing. I don't even have an excuse. I have a potty mouth, but I should be able to control it a little bit better, so I apologize for
last week was the first week that I came back to see Radu, where I had the stitches removed and he could actually see what was going on with my shoulder without the bandages on. And last week it was pretty raised, because I had 2 keyholes this time. The first operation there was 3, but the one around the front was really raised up, and you was doing the shockwave on that. Did you do?
I did a bit of electrotherapy as well.
On that as well.
Ultrasound and electrotherapy, and then shockwave.
And while he was doing that treatment, I was telling him like, this is sore. I was thinking this shouldn't feel the way it should feel, but I think you were saying the reason for it because you want to get that scar down, otherwise it's just going to stay raised, and it's definitely gone down. I'm sure today when we do the other treatments, you'll see how much it's gone down from what it was, because I was initially looking at this and thinking, well, if this is what it's going to look like, it looked like, I don't know.
It was like a massive pimple, isn't it?
Yeah, exactly that.
Like a massive pimple.
It was sticking out, but it's definitely gone down.
Aesthetically that doesn't look good, so we have to grind that down as much as we can. So today we're gonna go. My plan for today again to go through some more movement, more stability exercise. Obviously, it's a progressive increase in what we're gonna do. So what we're gonna do? We're gonna go here on the front. Try to clear your head as well. Bring the chin into this position here. We're gonna start from here. We're gonna try to go all the way up. Squeeze it up here like that. And from there, we just want to see if we can flow a little bit to that direction and back. We'll see where we can go. That's all I want to try. All right.
Do you want it to be just slightly?
Just slightly off, and then do like a little bit of a scapular retraction there like that, and neck, chin tuck like that. And try from there to squeeze your scapulas, and then bring your arms up a little bit, as much as you can. And from there, if you can bring them just a little bit around. In this plane, try to keep this in this plane like that. And then back.
That already feels like it's like...
Do you feel like it's grinding?
Not grinding, but it just feels like it's not going to come out straight.
No, I just want to see how it works. All right, so let's go again. Squeeze it. Lift the palms up. Lift them up as much as you can, really. And then try to bring it around a little bit to the lateral side. Keep them into a straight plane as much as you can. Okay. Now from there, what I want you to do from this position here, I want you to turn your palms, both of them, and try to come a little bit higher up if you can. Anything? Is that restricted in there, yeah?
That's as far as...
Okay, and then bring the arms back in here like that and turn them back into the position.
I'll tell you where it feels like it's like in here starts to feel like it's firing, so it's a bit locked. Obviously I can feel it through the delt, but here's in my trap. Like if I was doing a lat raise movement, just feels like it
just gets stuck in here. All right, so let's try. What I'm going to try to do now is as you're going to squeeze your shoulder blades together, I'm just going to try to give it a little bit of a direction in here to keep it pinned. Keep your scapula spinning there like that, and then I want you to bring your arms to the side.
I feel like you're pushing me off the bench.
Am I pushing you off the bench? Yeah, well I have to kind of put some force in there. So let's go again. Squeeze it. That's it. Hold it here like that, and then try to bring it around, because I need to just pull it down a little bit, and then try to turn your palms and bring it up a little bit more if you can. Or you still feel it's locked in here. Yeah, the traps are locked completely.
It
All right.
definitely looked better when you.
Yeah, when I pressed it down.
It felt like
Yeah.
it moved further.
Yeah, well that's
It
it.
didn't lift up so much like
I
before.
have to find the right position to kind of keep the scapula down. So let's go again in the same position. Squeeze them together first. So squeeze. Okay, like that. And then just bring it around.
I definitely don't feel straight though.
You don't feel straight?
No.
Yeah, sorry, because I'm pushing down. Just try to bring them around and turn. That's it, and back. Okay, how's that?
It's challenging. I felt like it moved more that time. It's just straight away, whenever I start to do a movement like that, it's like if I was to do like a reverse pec deck, which I don't do, it just feels like this just gets raised up, the trap, and it just fires. So it's almost like it's stopping me to get out.
And again, it's not the trap, it's the elevator scapula.
Okay.
Yeah.
It's literally just...
Is that just where the muscle's like weak and the other ones are trying to like help it?
It's because of the dynamic, the way his shoulder blade has been working, that's what's led to these severe, osteoarthritic changes in the joint. Basically, that's what led to the erosion of the joint and in the pickle that we are today, because of inefficient biomechanical work that his scapula was doing. And again, I'm gonna repeat myself here, but like the lack of scapular stability led into excessive movement into the shoulder and basically compressions in the shoulder that are not physiological, functional. Does it make sense?
Yeah.
So it's working on just again, like a linear isolating matter. You don't use efficiently any of the stabilizing muscles that are underneath the deltoids. And those stabilizing muscles, by the name of it, stabilize the shoulder joint. And your shoulder joint wasn't stabilized enough, considering how muscular you are. So imagine you working and just putting all that pressure through through your deltoids and working out with, because I presume you at some point you would work out with quite heavy weights and heavy loads, but those little muscles underneath were like atrophied and unstabilized and not able to support your shoulder joint. And those little muscles are the ones that support not your deltoid. Your deltoid is there, the hench boy to do the movement, a linear movement, but the one underneath were struggling, and then that's when your shoulder joint had excessive movement, which led to the erosion and inefficient loading into the joint, and led to the degeneration of the joint. So that's why we need to learn how to work more in synergy with the muscles around to create stability. Do you understand?
And you probably weren't bracing your core then, that's probably why the erected.
Well, yeah, very likely. But all we do is just learn.
Yeah.
So yeah, the muscle, as I said to you, I don't think, the trapezius will take over because, so it's partially the trapezius and it's partially the levator scapula that you feel. Now, that's why I said to you last time, we're trying to actually build up this rhomboid. Now the rhomboid, as I said, has got this big roll in here, and the cameraman can actually go and have a look at that, what it does. So you see it does the stabilization of the scapula. Now we're trying to create some hypertrophy on this small little muscle called the rhomboid by using this movement called the retraction of the scapula. And the biggest problem we have here, we get a massive muscle on top, again, the external, the one that's like, it's the biggest and the most visual on a human body is the trapezius, isn't it? Because you see the traps, they're always going to be the dominant one. But if the problem with us and how to apply that in rehabilitation, to use the rhomboids solely, we need now
to isolate the rhomboids. You see, that's where we get back a little bit, and it's a little bit of a philosophical matter here, because we actually want now, we don't want to work, we want to get all the muscles to work together, but we actually want to get to, for the purpose of the rehab, we want to get one muscle to actually isolate, and it's hard because that muscle is weak, small and weak. So, and the problem is that we have this massive muscle called the trapezius on top of the rhomboid, but look what it does, retraction of the scapula. So this little feeble muscle, not being able to actually do the movement, is going to appeal to this, come on, help me. And that's why this is jamming, but it's not only this jamming. What you also feel probably quite deep in, is this is the one that does the, you know when you try to lift the arm in abduction here, and all you can feel is the trap taking over.
That's exactly how it feels.
Exactly, but that's this. That's the levator scapula. That's this one kicking in and just pulling it up to compensate. Because you don't want to do the abduction freely coming from the glenohumeral joint. You actually want to lift the scapula, because he already, once you lift it, it gives you the impression that you did some abduction, but you did absolutely sweet fuck all abduction coming from the supraspinatus.
Pound.
Sorry.
No, I'm joking.
I'll just give out my wallet.
Yeah. But
So that's why you just kind of do that, and that's why it gets jammed.
yeah. And
So
from my point, everything what Radu's saying there, that's where I would get frustrated. So even when I've been training for the past few years, and I'm trying to do, let's say, a cable lateral wave movement, I can't move the weight I want to move, because exactly how you're saying there, that's what I just feel. I'm like this.
And that's habits, that's inherent. Like now, that is for you, that is your normal pathway. That's your normal synapse between your muscle and your brain to do that movement, to do like that, rather than doing it like this.
Yeah.
And we have to beat that
Yeah.
by creating that much repetition without actually using that muscle. That's why before we start getting into that's why we have to choose movements that hopefully will prevent that muscle to keep on clicking in. Does it make sense?
Yeah, it makes perfect sense. That's
So,
okay.
okay, so what we're gonna do, let me show you that. We don't have to go into abduction too much. We're just gonna go here, again, down like that, arms like here, start from here, see like about shoulder level, and just try to bring them up a little bit. And that's it, squeeze and up. Yeah, that's all.
Here.
Yeah, so lift just a little bit. Let's see how we can position there like that. That's it. That's it. I'm just going to squeeze and relax. Try to again go a little bit down and together. So down. That's it, much better. Was that grinding in there a little bit?
Yeah.
Okay. Let's try one more. Okay, that was much better. It was no grinding there, was it?
No.
Okay, try to keep the movement exactly how you did it now. That's it, that's perfect. Come from this side, Kerry, just a second so you can actually see. Just go on the far angle as well. Yeah? So you see exactly the angle that he's got the arms now. How's that feeling?
Is this even? I don't know if
Yeah, it's even, it's even. Do you see it even?
when I'm lifting it up.
Yeah.
Go again.
That's fairly even, mate.
That is.
That's fairly even. Okay, enough.
Me even doing that,
Yeah.
I don't feel like I'm even, but it could be because
Was even?
Yeah.
if no,
You look back at the videos, you
Yeah.
see you're even.
I think because when I've done it before,
I know, you are askew.
yeah,
Yeah.
and that's just become my normal.
That's your normal, that's what I mean. But look at that now.
I think I moved as well, maybe.
What? Well, look now, look here from this position. Look like correct engagement from both sides. Can you see it?
Yeah, so that's, how can I describe that? That, it felt like I was
Sideways.
lopsided.
But you weren't.
I can see it
Yeah,
there, but
yeah.
because I think probably what's programmed in my mind now.
Exactly,
because
well
I've
done.
been doing it for so long. That felt like this isn't right.
Yeah, but that's exactly what I said to you. That's what the apprehension creates. Creates this like unhealthy range of motion that becomes in your brain, these neurological synapses become your normal.
Yeah.
That is your normal. And now we have to break through those
Yeah.
to bring the actual what is the symmetrical and the normal, what should be the normal.
Yeah.
But your elevator scapular, your trunk didn't kick in there, so it felt quite a safe movement. As I said, we have to clean it out because I think you were coming a little bit too high.
Okay.
So just keep it quite here, because if you're seeing the video, when you're down like that, you can see, like basically you hold your hands here, pretty much in line with your shoulder. So
Okay.
don't try to go too much higher.
Okay.
Just keep it in line here and just do that.
Okay.
All right.
Yeah.
Grab this like that. Start from here and just go up as far as you can. Yeah, here. And we go, try to open and just go up a little bit like that in neutral position.
Are you pinning the...
Yes, of course, yeah, again, like the same thing. Try to engage your core here, stay nice and tight in the core, and try to pin your scapulas together. Yeah? And just look straight ahead like that, not like I will look down. There. Okay? Let's go. Okay? Try to keep it, what I want you to do, I want you to keep it more onto the frontal plane rather than lateral plane.
Wow.
So you go exactly, you go again into like a 45 degrees. So we don't want to go too wide, we don't want to go too narrow. So around here like that,
Like
and straight up.
scaption, really.
Yeah, scaption, that's well done, that's it, scaption.
But you want the palms up.
I
Sorry?
think you
want
need
the
to
palms
reach
up.
out.
Palms in neutral position, so about 45 degrees here. You don't want to be here, you don't want to be in supination too much. So kind of a little bit of a neutral position. And try to keep your elbows straight. That's it, perfect.
Better.
That's it.
Let me go for that.
Now how's that feeling? It's grinding a little bit, isn't it? Did you engage your scapula? Did you engage your core here?
I think that's the hardest thing, trying to...
Engage your core a little bit and try not to hyperextend too much there. No grinding. Just when you calm down, isn't it? When you calm down, I think you're losing the scapular stability. So when you calm down, even more so, try to keep this pin down, yeah? So go up. And keep it pinned, keep it pinned. Still grinds a little bit, isn't it? Do you feel any pain at all?
No pain.
Squeeze it. That's it. Try to stay rounded, try to stay even kyphotic in here. Yeah?
Okay.
And let's go. Okay, and now. How's that?
Yeah, mine is just...
Was it grinding?
Just at the very
Just
end when I got to
where
the top.
you went quite far there.
Yeah.
Did you feel the serratus at all here?
I feel like I've probably felt it a bit more, but again, it's trying to remember all those
That's it.
different
So
views.
just concentrate at the moment. Try what I want you to do. I want you to try from here to like basically round you. Now, when we talk about like scapular mobility, that's why we need to have this wider range. So we go from protraction to retraction. We have to get the more range you got into your scapulas and relearning how to move your scapula from maximum protraction to maximum retraction. That's what's going to give you the mobility that you need. At the moment, we haven't got that much of a plane there. That's why we need to, as much as we work in retraction, we also have to teach it how to stay in protraction as well. Does it make? And the protraction does come from the serratus.
Yeah.
Does it make sense?
Yeah.
So that's why we're going to try to teach it as much as possible.
Okay.
Okay, so what I want you to do now, as you hear, because you're quite away from the wall with your elbows, I want you to start from here like that and just try to, again, cave your chest in and then try to slowly put your weight into the wall like that. Does it make sense?
Yeah.
So try to stay protracted, push away from the wall initially, but then stay tight in here like that, and then with your hands like this, because here we'll be a little bit apart like that, try to get close to the wall with your forearms. And once you're there,
Then let's try to go, but like literally just by half a centimeter every time. Yeah? Let's try to do that. No, with your bands, with the bands. Okay, so again, get close to the wall, take the palms apart as far as you can. And from there, I want you to try to push yourself down into the wall to get your elbows on the wall. No, so we didn't start. So first of all, get your shoulder blades out as much as possible. And then from the elbow, bend the elbow, but keep the shoulder blades apart. And try to get close to the wall like that. So by bending, just literally just bending.
I don't feel like I'm going to get much
Go
closer.
a little bit lower, go a little bit lower, come a little bit lower. That's it, lower, there.
Yeah.
Palms apart. Because I want to see the reason why we can't do that. Get your shoulder, that's it. And now try to drift towards the wall. Try to get your elbows close to the wall. Get a little bit closer with it, with your feet as well. And from there, try, you say like I'm here, try to go there. So from there, shoulder blades out and just try to go there.
This or?
But you see you're using your scapula again.
Okay.
So you see, look at me again. So I'm out here like that, let me put the bands as well. Look. I'm out like that here. Let's say I start from this point here like that. Yeah? I cave the chest in and then I'm trying to do this. You see, I'm just trying to close. But with you it's probably because of the biceps. Let me see here. That would be this as far as we can go with the biceps. So it should be a little bit of a better range in here. So if you go to this position, come here. Go closer, here like that. So this is how fucking close we have to be.
Okay.
And from there, put the bands in. Put the bands in. You'll see where I'm getting with this. If we get this, that'll be a good exercise for us. So let's use this as a starting position. Keep the elbow in there like that. Okay, now cave your chest. Cave it, cave it, cave it. That's it, there. And now from there, let's try to walk our way up.
Walk up with the
Walk up a little bit, yeah. But still keep attention in there, yeah? That's it. How's that feeling?
That feels quite hard just to maintain and push that out and even move up. For me to stay there and move up, I just feel like this is going to go, it's going to grind. I don't feel like I can maintain holding this out to creep up the wall.
Can you try going up?
Sorry?
Can you like progress? So
Well, that's what I'm trying to see
without
if we can progress from there. Because like once we get kind of in this position here and push to the wall, if we can just literally go up like that, now we got the point of reference. Like basically, do you see what I'm trying to do here? I'm trying to get this up like that, go past that point, because this is your point where from there you turn around and you can fucking pose.
Yeah.
You see what I mean? That's what I'm trying to get there. And with a little bit of support, I'm trying to encourage that pathway to get you from here to that position where you can actually, from there, we can actually turn.
Yeah.
You see what I mean?
Yeah.
So you're trying to generate that strength. Bring it more towards you like that, that's it.
Pin the scapula down, or just let it move.
Just let it move, yeah, let it move down. That's it. Okay. Here and up. Up, that's it. How does it feel with that weight? Easy?
It feels better now you move my arm in from where it was the
Yeah.
first time. I feel like I can access a bit more range. Not sure how heavy you would put it, but I'm sure if I'm doing a few reps of this, it will start to add up.
I think it's definitely get more range now.
I don't know if I'm going as high now. I've got this too.
What?
You are.
I don't know if I'm going as high.
You are.
You actually are.
You are.
we did this when I first met Radu, this exercise, and I know it definitely didn't move as far as it's moving now.
No, he's moving better, yeah.
I think the best way I can describe it, if I'm going to talk about this session so far, just being totally honest, this feels good because I feel like the range is moving, the face down when we was doing it, I could feel that the movement. I'm watching back when I had the weight plates, that was great, but I'm definitely frustrated by this wall.
It doesn't matter, mate. We try. Listen, don't get frustrated because, as I said to you, we are trying things. It's experimental.
Yeah.
You know, it's not like we can follow a protocol with you. It's not a protocol. We have to find things that are suitable to you.
Yeah.
So don't get fucking frustrated
Yeah.
because everything is as much as experience I have.
Yeah.
This is a new territory here. You know.
And I totally understand what you're saying.
I'm not gonna go and pretend, fuck me, I know, like, you know, I know how I'm using my fucking common sense in here.
Yeah.
And I'm trying to treat you the best I can, using my experience from previously and common sense
And that's
to put together.
And that's me obviously saying, I understand everything what you're saying, but I'm just being real to the people who are watching now, how I'm feeling in this moment. And in this moment, because obviously it's desperate, I'm desperate to get it, and like Radu said, he doesn't know what's going to actually work and what's not without us actually trying it. But from my perspective, because I know I need to get to this position here to get into the pose, so I see it as, because I've not got that, it's like, oh, what do I do next to try and get me to that point? And there's no right or wrong answers at the moment for what's going to be the right thing, but I'm just feeding back to you guys so you can kind of know what I'm thinking in my head at this moment.
If we have to be real here, we just have to keep thinking, but that's not necessarily a good way of keep coming back and thinking about the prognostic that the surgeon made initially, and it wasn't a great one. You know, you heard what was said, and we are trying our very best, and that's what it will be the best outcome we can get with what we have to play with, you know. So let's take what's positive from today's.
Yeah, definitely.
And stay with that, because again, I didn't expect a massive increment in the amount of exercise or anything. You know, we just need to change the load. So now we change the load from 45 degrees to flat. You already start doing it yourself. Found that you find it like it's much challenging to do it from the flat. I explained why. We're not gonna get the exercises that do challenge us too much, because again, there's no point at this stage to do that. It's again, we're trying to get as much work from the muscles that we can work with, and then we're gonna every week, if we add 1 or 2 exercises that's gonna have a positive impact, that's what we want.
Definitely.
Okay.
Happy days.
Happy days. So first of all, what we're gonna do now, we're gonna work a little bit on the abduction, to be honest, to get this supraspinatus to kick in a little bit. So while I'm putting the electrodes on you, we're gonna do a little bit of just scapular, some abduction. So I'm gonna put the electrodes here and there, and we're gonna get the hand dangling down like that. I'm gonna feed it with a cable, and we're gonna try to bring the cable up. We could actually potentially stand up as well and do it, to be honest with you. You don't have to sit down. But let me
just going back to what you were saying about the levator scapula, how it kicks in, is there anything we could do you think, on that to make it or is it more just the retraining?
I'll work at the end, right at the end. I'm going to do some shock wave here, some electrotherapy, ultrasound onto the levator scapula to calm me the fuck down a little bit, but we do that at the end, alright? After we're going to do some more work, because there's no point doing it now, and then basically I'm fucking everything. Pin the scapula down and just try to go up in you.
I'm not going to get very far.
No, you don't have to. Okay. As far as you can. Just to get a little bit of the supraspinatus to stimulate it a little bit. Try to keep the wrist down, rather than like that, just down.
Down?
Yeah, flat.
Yeah, I can feel that more.
Yeah, well, you bend the fist again. Try to keep like exactly flat here. So don't bring it in palmar flexion, in dorsiflexion.
This.
Just flat. Keep it as flat as possible. Yeah, flat like that.
How's that?
Yeah, it's okay.
How many do you do?
If we started again from this, I would say we're on 3 now.
Alright. Let's go for 10 reps and then have a rest.
So where I'm feeling it now, you know when I used to say I used to do like rowing exercises?
Yeah.
That's the area where I feel it.
Why in the back?
Yeah.
As in grinding?
Not grinding, just like a dull sort of ache.
Uh-huh. Try to go a little bit more in front plane, like maybe. That change anything?
Yeah.
Yeah?
So let me try it again.
Because I didn't take into calculation that you're actually inclined backwards. So try to bring the arm forward a little bit. That's it. How's that feeling?
Yeah, that's alright.
Yeah?
Yeah.
Okay, and rest. Wait a few more minutes. Good, minute and a half or so, and start again.
So just for people who are watching, what's the benefit of what this is right now?
The lack of movement into your shoulder obviously has created some atrophy of the rotator cuff muscle, supraspinatus, infraspinatus. So what we, subscapularis and teres minor. So what we're trying to do now is try to get the supraspinatus. That's why we put the electrodes over the insertion, the distal insertion here, and on the scapular fossa there, subscapular fossa, where is the proximal insertion. And we try to get, with the help of this high voltage current, we try to get a little bit more tension into the supraspinatus to kind of bring it back to life a little bit easier.
Okay.
Make sense?
Yeah.
Yeah. Next week is going to be 4 weeks, and after 4 weeks you can start working on.
Yeah.
I reckon it should be alright to work on this side gently.
Okay.
Yeah, let's go again. How's that feeling? Grinding a little bit there?
Just lost it then.
Just you lost it there, didn't you? Do you see the difference between pinning your scapula and stabilizing your
I
scapula?
think the moment where, like, I'm getting to a point where I can
Maybe
lift
that's
it,
Yeah.
and it feels great, so I want to try and go a little bit more, but it's that bit when I go a little bit more that
Disengage and you
yeah,
grind.
and
Yeah.
then I lose it, so it's almost like I'm maybe just better off keeping it
Where it is.
that really short distance where it stays on, because I go past that little bit point where I'm trying to get activate that extra range.
So that's what happened. That's why I'm trying to explain to you that's what happened when the humeral. That's when the humeral head. So the flattening of the humeral head moves into the position where it clunks. You know, that's the problem.
Okay.
That's the resistance that comes from the abduction.
But we're trying to bypass that.
That's my hope. That's my hope that the more stability we get in from the muscles, like if you get the supraspinatus, infraspinatus pulling into that direction, is kind of that balance is going to give the chance for the humeral head to sit, as fucked as it is, at least to sit centrally in there, so it works on the stability of the rotator cuff to kind of dictate the right range without actually overlapping into the humeral head.
Okay.
You know,
Yeah.
because the purpose of that is to be able to get you into the double biceps pose.
Yeah.
We're not necessarily doing everything we can to get you to exercise and exert yourself into this position here. You know, because you found ways around in your training to still keep this, you know, enormous muscular mass. So we're going to be able to get exercises to get you to tone you and, you know, get what we want to achieve from the muscular point of view. But for you, the biggest downfall is the fact that you can't pose, isn't it?
Yeah.
So that's what we're going to try to do, not necessarily to get
Yeah.
the range so we can do the movement. We want to get the range to get you into the position there. That's the main scope, isn't it?
Yeah. I think with that as well, I think it's going to be when you're training, remembering these extra cues with keeping it engaged as well, because like doing the lateral raise movement where I've got to keep it pinned so it's not grinding, because if I go back to my first operation, what I had afterwards when I was still training, I knew those movements, there was a certain points I was still feeling that grinding, but I didn't know what I know now, what I've been working with Radu, that I need to keep that scapula engaged even more to avoid that. So yeah, it's
to create the stability and avoid excessive, excessive and incorrect loading of the shoulder joint, which causes the inflammatory changes and degeneration and adhesive capsulitis, aggressive adhesive capsulitis. Okay.
What's this one, sorry, Radu?
That's the one for the capsule. Basically, it's a program for the frozen shoulder to just keep that capsule as happy as possible.
Yeah, that's about 7
Too much?
I can ride it out.
Can you?
Yeah, I hope
Sure.
so.
You sure?
Yeah. How long am I here for?
20 minutes.
And what does this ultrasound do?
Accelerates the blood flow, breaks down some of the scar tissue that's being built up underneath, especially that's why we're working more onto the front here where the instruments, so the insertion for the surgery was made. When you have kidney stones, we use ultrasound to break them down.
Okay.
So you can imagine what it could potentially do. You actually have a side where you can actually blast and break down some of the scar tissue, in the same time accelerating the blood flow. You will increase the amount of nutrients in the area, which again will accelerate the healing process, keeps the tissue quite supple. So yeah, that's what we're trying to achieve with this. Works on a little bit on the pro-inflammatory compounds, and what it does, it's shocking the body, but in a way that's not destructive. But the response from the tissue that's being targeted is to rush IGF-1 to the area, and IGF-1 is essential in cell regeneration.
So that is the third session, post-op number 2 with Radu wrapped up. I can see now each session is progressing that little bit more, taking small steps, trying to move forwards to get to where I need to get to. I'll be totally honest, after this session, just like last week when we've had the use of the shockwave, the ultrasound and the electrotherapy, I'm ready to sleep. But this again is like what Radu says, it's taking the rest in between, so I won't do any sort of rehab now over the weekend, and then Monday I'll go back and start to work on every other day and adding in extra stuff what we've worked on today as well. So again, thank you for your time, Radu.
Always a pleasure, Whitman.
Like this session here, you guys wouldn't know, this should be a follow-up session what lasts an hour, but Radu's always here to give me extra time, and we've definitely gone over that time again. So on his last appointment of the day, and he's gone out of his way to make sure that the distance that I'm travelling, and he also realises that this is really important for me and also my career, that he's putting in that extra time, so I do appreciate it. And it doesn't go unnoticed.
Always. I know you need the extra time. I'm aware of that, and that's why I put you to be my last patient of the day. That's why I change you around, and I'm trying to accommodate you as much as I can.
Yeah.
So we can try to do a thorough job. I know your needs of, like, obviously informing your supporters as well, your fans and that. So I do everything to accommodate you, because I know you've been mugged off in the past. So
Yeah.
at least you got someone on your side this time.
Yeah.
Was not only interested in
getting your dollars.
Yeah, that's it. So that's it for today's session. Thank you guys for tuning in and following sort of what's going on in this journey. It is much appreciated, and I'm going to end it there.